First thing I'm going to do in a zero balancing is evaluate the shoulder rhomboid area, just getting a feeling for what's going on in the person's body, as well as giving them a feeling for my touch. And then I'm going to do some circumduction of the shoulder, again, to get a feeling for how is their energy and structure functioning through the shoulder girdle. You also can tell the person's nervous system. There's some people, if you do this and then you take your hand away and their arm ends up staying up in the air, you know their nervous system is in a certain amount of distress. You're in good shape there. Then I'm going to come behind and work my way down the back, just feeling off the tips of the transverse processes of the vertebrae. Again, sampling the back tension that we've all got. And then coming down and at the sacrum, asking you to lean to your right and then to your left. Now, when the person leans one way or the other, what you should feel is as Charlotte goes to the right, I should feel that the sacrum moves a little bit, yields anteriorly to that same side. And if it doesn't, then that gives me an idea of where back tension may be being held. Although she's already said it's more mid and upper back. It feels good. Why don't you lie down with your head here? Face down? Yeah, face up. Zero balancing is one of the few bodywork forms that can be done clothed, although it certainly can be done with clothes off with the draping. But it's kind of nice to be able to have it. But could I ask you to take the belt off? I forgot. Okay, great. First thing I want to do is help decompress the whole skeletal system. So pulling with a straight pull and then adding a curve and holding it. This also gives me a sense of how easily does a person let go. Some people you'll do that and it'll feel like the legs just lengthen very easily. With other people it feels like a car with the emergency brake on and you're not going anywhere. So it's a good readout for the person's energy overall. Then I'm going to come in and pressing on either side of the ilium, feel for the relative yield of the ilium with respect to the sacrum through the sacroiliac joint. Coming underneath, working into the sacrum. And it took me, I can say it took me a year or so to realize that my focus was not the soft tissue, but it was bone. Because as a massage therapist, I had spent so much time in the soft tissue that I was thinking erector spinae, quadratus lumborum. And I'm fine with doing that. But in zero balancing, the idea is that you really visualize the bone is living tissue. Obviously, we think of bones as dead because normally we see bones, they're dead. But in a human being, they're responsive. They say the trabeculi in the bone starts to reform its shape within 7 seconds of adding pressure to the bone. And you know, that it could be so changeable on that level is surprising. So what I'm doing is feeling for tension in the lumbar area and in the rib cage. And when I find it, just holding that. Zero balancing is not particularly a system looking for pathology, and we're not trying to identify, oh, here's this subluxation or that. What we are looking for is how to enhance health and energy flow at the level of the skeletal system. So by just pressing in and holding, the person starts to feel a flow through a stuck place. Just like when you hold into a trigger point in soft tissue, person will start to feel a yield happening. So indeed here we're looking for that, in that case through the lower thorax, lumbar area, and sacroiliac joint. And then want to look at the hip joint. Mark was talking about how the hip is so often related to knee pain. So often people experience their hip as if it was originating from the greater trochanter, from the outside of their leg. But the truth is, if you look at the skeleton And I've been recently working with somebody with IT band syndrome, so it's been really neat to be able to share this with her. The heads of the femurs actually are only a palm width apart where they go into the acetabulum, that is, into the hip joint. Whereas, of course, the greater trochanters out here are quite wide. Your weight actually transfers to the legs through something that's only a palm width apart. So when I read the hip joint with medial and lateral rotation and notice how the ligaments engage, I'm bringing the person's awareness into where their hip actually is. And then I start from a straight position and add a little traction and rotation and hold it. Again, like with yoga postures, you want to hold the joint open so that the person can start to feel deeper and deeper letting go. And we say energy, but you could equally use the term nervous system, because a person does not relax without a change in the nervous system. You know, when we first start doing therapy, we think we're working on muscles, but then you realize, well, if you're really aiming at relaxation, muscles are not self-relaxing entities. Muscles only relax if the nervous system tells them to. Like lights only go on if there's electricity, not just if you flick the switches.